On 26 May 2023, President Yoweri Museveni assented to Uganda'S new Anti-Homosexuality Act 2023, prompting some organizations and individuals to run to court seeking its annulment amidst mixed local and international reactions, with President Museveni describing this as war.
We shall move. If they cut aid, we shall sit down and discipline our expenditure, rearrange our budgets. If they interfere with our trade, we shall trade with others. So that one is not my, and that's what I was telling you. The other time when I met you at Kololo, I said, you people, you should be ready for a war. And you cannot fight a war when you are a pleasure seeker, if you like a soft life. So a war is not for soft life.
As petitioners await court's decision, Uganda's law against the sexual minorities has increased their pride, forcing many to flee their shelters due to different forms of escalating harassment, discrimination, and other threats. The new law prescribes death penalty for aggravated homosexuality, defined as cases of sexual relations with people infected with HIV, as well as with minors and other categories of vulnerable people. In this in-depth story, key populations seeking HIV care choke on Uganda's Anti-Homosexuality Act 2023. I brave the threats on ground to expose how LGBTQIA members are struggling to access HIV care, focusing on Western Uganda, connecting the dots with other parts of the country. I am Ainomugisha, Rise News Uganda Network, Internews Health Journalism Network, Microphonics Trust HIV/AIDS Reporting Fellow. At Mbarara Regional Referral Hospital, a government health facility in Mbarara City serving over 10 districts of Ankole sub-region, many homosexuals are already struggling to access services after their network and leaders under Subuchi Healthcare and Hope Foundation Uganda shifted to the capital city Kampala, fearing the consequences of the repressive Anti-Homosexuality Act.
Our center is Subuchi Health and Hope Foundation Uganda. We offer services which range from HIV prevention. We also support care and treatment. We are supporting HIV prevention services among members of the key and priority population. They're actually our colleagues because some of us fall in the same categories. We screen them for PrEP eligibility, we screen them for HIV exposure. We distribute condoms to them. We offer them lubricants and support them when they have their psychosocial needs. We refer some of these clients who are eligible for PrEP to the nearby health center, but as you know, a majority of these colleagues of ours tend to hesitate going there because they are discriminated. And they don't feel comfortable going there to seek services. We also support them to disclose their statuses to their close colleagues who can support their treatment. We do follow-up for clients who are on PrEP to ensure continuity and have sustained HIV prevention control amongst our colleagues. We have also screened and referred some clients for other STIs other than HIV for appropriate treatment.
A stone's throw from Mbarara Regional Referral Hospital is the AIDS support organization, that's Mbarara Regional Facility, that generally serves 6,354 clients, including over 8 transgender men and other key populations from Mbarara, Isinjiro, Tungamu, Rwampara, Greater Bushenyi, Greater Chiruhura, and other parts of Western Uganda, according to Dr. Rosemary Yabazibwe, the facility medical services technical lead. Dr. Rosemary confirms that the passage of the Anti-Homosexuality Act 2023 has caused a decline in homosexual clients. What is the plight of the victims?
Talking about the key population, and we are looking at different categories, female sex workers, we are looking at MSMs, we are looking at transgenders and other different categories. The way we reach out to them is through the peer-led model. We use peers, their fellow peers that understand their dynamics, that understand their characteristics, to reach out to them. When we get a peer, the peer leads us to the group, and then we are able to test them for HIV, and we are also able to use the peer to take for them ART, and when they are due for bleeding, we also use the peer to remind them to to come for viral bleeding. So we basically use the peer-led model to reach out to them. And then we also have what we call in drop-in centers headed by peers, where they can go and access all services they need. And in case of a transfer, they are able to be transferred to the facilities. But there are some who are also okay walking into facilities because the staff have been oriented on a key population, how to handle them. They have had mentorships, they have had trainings. So we are able to handle, if they are able to work in the facilities, the staff are ready and they are able to handle them. We also received a letter from Ministry of Health telling us not to segregate when we are giving service delivery at facilities. So when they come, it's not about the gender. We are able to treat them, we are able to associate with them, but I would say maybe it will affect them outside the health facilities, maybe in the communities, in their social work.
Some LGBTQIA members outside there whom we are not serving because they are afraid to come through, or they are seeking services from facilities outside Tasso. How best can we ensure that they are served without being discriminated? Because in the wake of the Anti-Homosexuality Act 2023, we hear so many outcries coming up on top of the harassment that has been existing before the act.
Of course, when the Anti-Homosexual Act was passed, there was a drop in the LGBTI group particularly, because some of them were scared if the health workers could still receive them. So some of them became the lost follow, some started missing their drugs, some of them missed the services they were supposed to get. But then we have outreach services which we offer. We get a peer and we give them a coupon and they get some incentive. Then the other person also brings another one. Then we also have what we call social networking, where we get one person who leads us to everyone of the same characteristics around them. And we are not saying that all of them receive services from Tasso. Some receive services from the main hospital, from different health facilities.
As someone who is an expert in healthcare, what would we tell the policymakers and other members of the community pushing for a harsher environment for the homosexuals and other sexual minorities?
I would say when it comes to service delivery at facilities or hospitals or private clinics, it should stay neutral, because our work, we are not here to judge as health workers. For us, our work is to give services, whoever you are, when you come into the facility, equal services, equal rights for every person, whether you're transgender, whether you're LGBTI, equal services. That's what we are supposed to do. Like Ministry of Health has written a circular, I would say we keep pushing that. And even staff that are not yet oriented, they should be oriented, they should be mentored, they should be trained so that they're able to give services to every person that walks in their facilities.
With the already existing sexual and reproductive health and rights gaps hindering social justice, Uganda has come under attack from the international community and progressive voices within, though anti-homosexuality defenders claim the law is meant to protect children. But what does this mean in the fight against HIV/AIDS? Honorable Rita Tukwasa is a female policymaker representing Mbarara City in the 11th Parliament. As a woman member of Parliament, Mbarara City is Western Uganda's biggest urban area, connecting Uganda to Rwanda, Tanzania, and Democratic Republic of Congo, with 13 health centers where some LGBTQIA members are facing discrimination. With the current SRHR gaps already,
yes,
and then we have the Anti-Homosexuality Act 2023. As a leader, how best can we ensure that these sexual minorities are not harassed when they are accessing HIV care?
I think HIV care looks at everybody. And the good thing, the people with sexual minorities are Ugandans, and they are children of Ugandans. And even the law on anti-homosexuality does not say kill them, no. It is protecting a child. It says, do not entice, like we protect children against defilement and rape, like we protect women against rape. The same thing, if you are a special interest group, LGBTQI, go to hospital, be able to get treatment. We are not saying don't get treatment. And in each health facility, they designate people who are trained in those specialties to be able to handle such cases.
In separate statements dated 5th June and 8th August 2023, the Health Ministry reiterated warnings to healthcare providers against discriminating key populations, since health is among the fundamental rights incorporated in Chapter 4 of the 1995 Constitution. In this story, I exposed the escalating discrimination, arrests, threats, and other attacks against LGBTQIA members in western Uganda and other parts of the country like Kampala, Mukono, Wakiso, Jinja, and other hotspots. How are you, together with your LGBTQIA members, trying to cope with the situation since May, when President Museveni signed the Anti-Homosexuality Act 2023?
We had put up a temporary DIC. You saw the state in which it was, you saw its location. It was along the way where there is no privacy with our clients, and you know the categories of people that we are and those that we serve. We need privacy, and it was unfortunate that on Saturday last week, the landlord chased us from that house. He came and told us he no longer wants us to pay, that he got to know what we do and he's not comfortable with us in that area. It is so unfortunate that after disclosing who they are and what they are, some of them have been actually neglected by their families. They have been chased away, are finding it hard to look for where to stay. They're in a sorry state. Some don't have food. Some will tell you, I sleep under the pipes in the roads because my parents chased away from home. When this anti-homosexuality bill was passed, fears and tensions increased, and that is really what we are going through.
Different Ugandan social activists and human rights lawyers have punched holes in the Anti-Homosexuality Act, arguing that it greatly undermines the constitutional provisions of the right to health, freedom of association, choice, privacy, and other freedoms, besides threatening healthcare providers' jobs and patients' confidentiality. Human rights defender Winnie Byanyima, the executive director of the Joint United Nations Program on HIV and AIDS, UNAIDS, in an interview with Sky News after the passage of the Act, further raised red flags that Uganda's Anti-Homosexuality Act undermines the HIV response and hinders the fast-track approach, a big setback in the fight against HIV/AIDS.
Such laws get into the way of people accessing life-saving health services. This law undermines the HIV response in Uganda because people living with HIV who happen to be also gay or transgender women will be further discriminated. There will be more discrimination. They will be pushed away from services that could save their lives, and they are Ugandans too. This law sets us back in our fight to end AIDS. We can't end AIDS unless everyone can be reached by services for prevention and treatment.
The international pressure is piling up, with funders like the World Bank already suspending public financing to Uganda. It is upon me and you to embrace coexistence, create safer spaces, happier society, and make the world a better place for everyone. I am Ainomugisha, Rise News Uganda Network, Internews Health Journalism Network, Microphonics Trust HIV/AIDS Reporting Fellow.